And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Interim General Manager at WEIU TV and Radio. My co-host is Muhammad's favorite son, Tristan Thomas.
Good evening. Glad to be here.
And our guest today, making a return of visit, is Dr. Eric Davidson.
Hi. Thanks for having me back.
The Executive Director of Health and Health and Counseling Services here at EIU. So pull that mic just a little bit closer to you, Mr. Davidson.
Sure.
Well, you know, we always joke that we hope someday that you're not on as much as you are, but it's important. We haven't had you on in a few months, and I thought we'd just give maybe today, you know, obviously we're going to talk a lot about COVID and where we're at in this pandemic, and if we're nearing, you know, some kind of, you know, any changes coming up. But right now, where do we stand in terms of EIU and maybe, you know, focus a little bit on more of the EIU than the Coles County?
Sure. I think EIU is really in a great positive place. One of the things that's far different than last year is vaccination. So through the governor's executive order, we require our staff, our faculty, our students to provide proof of vaccination, and if they don't provide that, they have to test. So right now, our employee vaccination rate for COVID is about 78-79%, and our students, between our students that are fully vaccinated and those that have received some form of vaccination, we're just shy of 75%. So we're really happy with those rates, and we think that that's contributing to what we're seeing on campus.
Okay. When you say like the employees are at 78% and the rest of them are getting tested weekly, so has that been a smooth process? Has there been hiccups along the way?
You know, I would say it's been a process that's evolved. I mean, at the beginning, we weren't seeing the numbers that we wanted to see. We kept plugging away, doing a lot of notifications, and then the university implemented progressive discipline, and through that process, every week that we get further into progressive discipline, we're seeing more and more people testing or more and more people submitting vaccination records. So we're happy with that process as well.
Is there a certain vaccination threshold we could get to maybe to see, you know, obviously some of the, you know, the masking and stuff inside is back. Is there a certain level with that we might, you know, see those things maybe change?
Yeah, I don't know if it would necessarily be the vaccination rates. I think probably what the Illinois Department of Public Health and the governor's office will be looking at will actually be spread and contagion. So if we can continue having decreased numbers and continue on the projection that we're at, I think we can go back to that. When we will go back to that, it's kind of hard to tell. The thing that I always tell all my friends is, you know, COVID may be this way today, and tomorrow it can be a completely different story.
Are still people finding themselves being tested positive? I mean, are there still COVID cases on campus? Do you have any numbers on that?
Yeah, so last week, for example, we tested approximately 1,100 students through the SHIELD surveillance testing, and we had less than a 1% positivity rate. So I think last week we probably had 10 that tested positive out of that 1,100. So our positivity rates are really low. Less than 1%. We're very happy with that, but we're still seeing people test positive.
And do you correlate that then to what's going on in Coles County, or how do you extrapolate that? So when you think about that 1% compared to Coles County,
you know, I really don't make comparisons, mainly because, you know, when you look at the larger county, you've got older populations, you've got K-12 school populations, you've got youth under 12 that haven't been vaccinated, so it really is apples to oranges. So I typically just focus on what we're seeing at Eastern and how to best address what we're seeing.
Okay, Tristan?
Yeah, here on campus with the health services, is there what's available to students? We'll start there.
Okay. Well, in our medical clinic, we're staffed with 1 medical doctor and 3 nurse practitioners. So pretty much we're a standard primary care clinic. So we see a broad range of things, but, you know, typically with college populations, colds, flus, sprains, strains, STIs, but, you know, we will see students that have some cardiac issues, allergies. We really kind of get the whole spectrum of things.
What advice do you give to students when they ask you about the concerns or just the campus COVID rate and all that?
Yeah, I think it's mainly instilling the preventative protective behaviors. Make sure that you're masked, get vaccinated, make sure that you're maintaining social distance, continue to wash your hands. I mean, a lot of the things that I would encourage as protective measures are great protective measures for other illnesses and contagions such as flu and RSV and those types of things.
Speaking of vaccinations, is it an ongoing thing? How do the students need to set an appointment, or what's the process?
Yeah, we've got a lot of different things going on. So typically for our medical clinic, we have vaccination clinics on Tuesdays. So if a student wants to have the Moderna vaccine, whether it's their first or their second, they would need to call the medical clinic and make an appointment. We also work with the Illinois Department of Public Health and the Illinois Emergency Management Agency, and they'll actually be having a campus clinic a week from today. So they'll have people coming, and we'll have a 10 on the quad, and they usually bring all three of the different kinds of vaccines. So whether a person wants a first vaccination, a second vaccination, or if they qualify for a booster vaccination, the IEMA folks should be able to provide that.
Okay. We were talking a little bit about discipline and the discipline levels that go up. Can you go through that?
Sure.
So people know.
For students, it's a little bit more concrete and black and white. When it gets to faculty and staff, it's a little bit different depending upon what job classification you may be in, if you're represented by a bargaining unit. But typically for students, the first time they miss testing, they get a warning letter. The second time, they will have a fine of $150. A third time, a fine of $150 and be put on probation. And then if they miss 4 or 5 times, it's still another $150 and then suspension. So there are some significant ouches if you're not testing. Staff and faculty typically follow a similar process, but again, some differences based upon what your classification may be, but typically a written warning, conversations with your supervisors, some discipline that way, and a continuance. So,
can people be let go at Eastern Illinois University by not adhering to the rules?
It could be possible, yes.
Okay.
Yeah.
And students could be suspended. Could they get kicked out of college?
Yes, that could be possible. The executive order from the governor talks about exclusion. So if you've got individuals that have not shown proof of vaccination or are not submitting to the testing, that is a possibility. We hope it doesn't happen, and we're trying to do everything to avoid that, even including going out and hand delivering letters and calling students to prevent them from getting that far down the line. But it is a possibility.
But for the most part, people at Eastern, students and faculty, are following the
for the most part, yeah.
That's got to make you feel good. I mean,
yeah, I think
there's
so.
always an exception to every rule, but
exactly,
because that's the scariest part of this whole thing,
yeah.
right? So, but Tristan?
Yeah, I think at this point with COVID, we've been dealing with it for a long time, and I know a lot of people have a lot of just fatigue with everything, with the masks and the distancing and all of that. How should people manage that, do you think?
It's hard. I have some of that fatigue, and every day I kind of have to wake up and say, okay, things haven't changed. Have to continue playing by the rules. If I don't play by the rules, hopefully nothing bad will happen, but something could, and really try to just reaffirm myself to do the right things. And we do the same thing with our kids at home, because, I've got 3 teens, and they're getting tired of it too. And it's hard being the son of Eric Davidson, because, everybody's watching them and going, oh, you didn't wear a mask. So a lot of it is constantly reminding ourselves and also telling ourselves that this is not only for our benefit, but it's really for the benefit of our community.
Speaking of rules, that's one of the things I think is really kind of made everybody a little bit discombobulated, for lack of a better word, is some businesses and really are strict about the rules, others aren't. So do you kind of wish if we could go back in time, there would have been just one set of rules we could all follow? Or because, I mean, how do you enforce rules when sometimes 3 different businesses you go in might have 3 different sets of rules?
Exactly, and it makes it hard. I mean, it would be nice if everybody was uniform, but, when you look at our society, we're not uniforms. We're not clones. We don't all look at the world the same way. So I think you're going to see those variances. And, from a policy perspective and enforcement perspective, it would make things much simpler if everything were consistent. But that's not the reality. So I think you just make the best of a situation. And, if you're going to a business and you disagree with mask wearing and they're insisting on mask wearing, you do the respectful thing and you wear the mask.
Or you don't have to go in.
Or you don't have to go in.
Right.
I mean, you have another choice. You can shop online. You can get materials elsewhere. You could go to another store. I think that's the great thing. But I would encourage everybody, be respectful, think about others, be altruistic, and even if it's not your belief, wear a mask, get vaccinated. All those things.
If a student tests positive, or actually, I guess this could be a student or employee, but I want to focus on the students.
Yeah.
So we have Tristan there. I think it's a good example to kind of with a student tests positive right now in the middle of the semester. We're almost to midterms, correct?
Yeah, basically. Yeah.
So what happens to that student? Can you take us through the process?
Yeah. So typically, we will become notified of a student positivity either through Dr. Simon and her contact tracing team. We find out about it through Shield testing, or the student actually contacts us and lets us know. Once we have verified that they do have COVID, we then end up triggering a notice to the student's faculty and basically saying that the student's going to be gone from this date to that date, and the provost has worked with the deans and the faculty to get the faculty to work with the students and come up with accommodations and alternative assignments and methods and things like that. If the student lives on campus, they are moved to quarantine isolation housing, and during that period they're pretty much to themselves. They're provided lunch, they're provided dinner, they're provided breakfast bars and cold food for breakfast, so we're taking care of those needs as well. If a student lives off campus, they'll typically work with the contact tracers to figure out their living and dwelling arrangements. If they're able to isolate there in that housing, dwelling, residence, or if the roommates need to leave and kind of figure that out case by case.
Could you take a student who's off campus onto on campus? Is that a possibility as well?
We are not doing that,
Okay.
and part of it's just contractual and liability arrangements.
I understand. I'm just trying to think of all these different, because there's so many scenarios.
Exactly.
That I think sometimes
Exactly.
the layperson doesn't think about. The other thing is, and I don't want to put things in people's minds, but how do we know for sure that people are really quarantining correctly? I mean, do you watch a student in housing you can't watch them 24/7, can you?
Yeah, we can't. So interestingly, what I would say is for the students that are put into isolation and quarantine on campus, there are still non-quarantine isolated students living in that area. So a lot of times if somebody is perceived or believed to be breaking quarantine or isolation, we typically hear about it pretty quick. We also have a good number of staff that are working in that area and kind of keeping an eye on things, and typically if they see someone that they believe is violating, they'll call and let us know. And the contact tracers are also in contact with the students, and the students have to fill out and respond to kind of a verbal survey, and that's part of the questioning. So there's a lot of effort making sure that the students are where they need to be.
Okay.
Was the surge in cases to start the semester something you guys were anticipating? Was it something you were kind of stretched thin maybe, or what was that like?
Yeah, I mean, it's the Delta variant, and I think the Delta variant surprised everybody. So when we were beginning to look at the fall semester and plan for the fall semester, early spring, late spring, early summer, midsummer, that really wasn't on our radar. We kind of thought that we had slid down to the end tail and we would kind of be able to resume a campus environment that would be typical of what Eastern would offer students, and then the Delta variant just kind of exploded. So on one hand, it did take us by surprise, but on the other hand, we had planned well enough that we were able to pivot quickly and respond accordingly.
How will Eastern respond to a couple of things that are coming up? We have EIU homecoming in a couple of weeks. Then I know trick-or-treating is not as big on campus, but it's going to be in town.
Yeah.
So when you look at those things, what's your advice?
Many of our activities for homecoming are outdoors, so we'll follow the current CDC and IDPH guidelines. Won't have to be masking if you're vaccinated. If you're not vaccinated, you'll be encouraged to mask. Encourage the social distancing aspect. If there are indoor activities, we'll continue to abide by the CDC guidelines and everybody mask and do our best to maintain some social distancing there. I just read this morning that Dr. Fauci had basically said to the nation, go forth with Halloween and act as if it's any other Halloween other than last year. So I imagine, I know, for example, our Greek community will often have trick-or-treating out in Greek Court. I imagine that'll take place, and again, masking where appropriate, social distancing, and those types of things. I haven't had a chance to talk with Nathan Ware about that to see how that might play out at Greek Court, and I would imagine with the residence halls, it may be the same scenario too.
As you look towards Thanksgiving and Christmas, I mean, I know most kids are still going to go home even if we tell them not to.
Yeah.
Are you concerned about the travel and things like that when they come back?
It always concerns me, and I would say that even before COVID, when it would come to matters as flu. You're getting different risk pools interacting typically with holiday dinners. People go to holiday dinners regardless of whether they're well or sick. Everybody goes to grandma's on Christmas Day to get their Christmas gifts, and usually we'll see a little bit of a spike in flu after Thanksgiving and a more significant spike of flu following the winter holidays. So, I mean, it does concern me, but I think we've got such great vaccination rates among our students. I think that'll be kind of mitigated.
Okay.
Yeah, also with the counseling services you guys offer, what is available to students and staff with that?
We have a counseling clinic as part of Health and Counseling Services. We have counselors, some who are licensed professional clinical counselors, some who are licensed professional counselors working on being the LCPCs, and then we also augment our staff with a number of graduate interns who are studying to be counselors. So we see a wide variety of things, ranging from students that are having transition issues, breaking up in relationships, to students with depression, anxiety, and in some cases psychoses. So we offer individual sessions. We have groups that are currently in play. We have a grief group, an anxiety group, a mindfulness group. So, we're doing our best to reach our students. We've also partnered with LifeLinks, which is the local county mental health center. They received a grant to provide counseling for free for individuals that are impacted by COVID. So we're working with them to expand our counseling options, and they're going to start seeing some of our students who meet the grant criteria. So we're pretty excited about that.
I know mental health awareness and mental health has really been in the news lately. Have you seen an increase of students talking about it and wanting to talk about it?
Yeah, students talking about it, students experiencing hardships and difficulties, students coming forth and seeking care. I mean, I think part of it is as time goes along, counseling has less of a stigma and more people are open to it, but definitely the pandemic has exacerbated a lot of symptoms, a lot of issues, and luckily we've got students who are reaching out for help.
Well, I noticed yesterday during the NFL games, about every fifth commercial was about mental health. So the word is out there, so you could really tell a difference.
Very much so. I mean, we talk about COVID being a pandemic, and I would say mental health
It's kind of an after
locally and
yeah,
nationally is there. And we were seeing increases in mental health concerns even before COVID. I think it's just they've worked together synergistically, and it's kind of worsened this situation.
Throwing this one out, not really has to do with COVID and EIU, but I did get an email today that there's a drastic need for blood in this country. As a doctor, talk about that and why people should give if they can.
Yeah. I mean,
and how vaccinations play into that.
Yeah, I would say anytime they're calling for blood, we need to heed that call. It's been 5 years since I went through a major surgery, and through that major surgery, I needed blood. So I can't give blood as a result of that, but I really encourage people to do that. I think it's a great service. It's being altruistic, and what I like to tell people is you never know when you will need blood, and hopefully when you need it, it will be there, and it's really important to give.
Okay.
Yeah. So with the vaccine, there's a lot of misinformation out there. Is it more of a thing of like the vaccine, helps prevent more about the spread, or is it more about preventing the major health issues that the Delta variant certainly can cause?
Vaccines are interesting because when you get injected with a vaccine, it really is intended to kind of spark your immune system. So that way, when you do get exposed to a particular virus, it's kind of jump-started and the immune system can fight that off. Now, some vaccines are what we call sterilization vaccines and will greatly reduce the ability of an individual to spread the vaccine from one another. So it's good because it helps reduce your likelihood of becoming greatly ill. And we see that. Folks that have had the COVID vaccine who end up later getting the virus may get sick, but they're not ending up in the emergency rooms and critical care as frequently and as much as those that haven't been vaccinated. The current vaccines seem to have some sterilization effect, so that helps. But what I always like to say is you can't just have a one-shot approach. I think vaccinations, hand washing, masking, social distancing, all of those things together synergistically reduce the likelihood that you're going to get the virus as well as have negative ramifications should you end up getting the virus. And it also helps prevent it from getting to other people.
Does the flu shot should you still get the flu shot if you've been vaccinated?
Oh, yes. Okay. Yes, definitely.
And then the booster, is the booster going to be available at some time on the campus, or
I believe so. Again, next week when IEMA comes, I think they'll be able to give it to those individuals that meet the criteria. Currently, right now, the medical clinic only has Moderna, but we're going to be working on seeing if we can get some of the other vaccines. So we'll probably be planning to offer boosters as well.
People that feel ill in any way, vaccinated or not vaccinated, should just basically call in sick, stay home from school.
Yes.
Still.
Yeah. And call your medical provider and seek consultation and advice from them.
When you are out in the community and you're from around here, so you've got local ties, obviously. What do you notice that's both good and bad? I mean, you don't have to say I went into this restaurant, but the good and the bad out there in the community.
I think for me, and I think this is just because of my profession, I'm always looking around to see how many people are masked or not, and. I think early on in the pandemic, I focused more on who was not masked. And now I think I'm kind of focusing more on who is masked and paying attention to that. We have not gone out to eat at restaurants as much as we were before COVID. But when I do go out to eat, I'll kind of look around and see who's masking and who's not masking and how they're handling bringing food and drinks and things like that to the table, and be a little bit more aware of that. And I've kind of embarrassed my family once or twice by saying, hey, can you put your mask up, or
We've become a more observant society.
We really have. So I think I've become more observant of what's going on. I think the other thing that I've done as a dad has probably been more attentive to the friends my kids are hanging out with and whether or not they're masking and doing all those things, because I really kind of suspect that if my kids are hanging around those that aren't masking when my back is turned, my kids aren't masking. So
or when they come over somewhere, it's not that hard to go wash your hands. And I know that's what my son is. My son, who's actually still at home, is like, yes, wash your hands when you come home. It's not hard. It takes 20 seconds, maybe, at least.
Yeah.
Go ahead.
Yeah. Are there any other? Are there any like overall health things you think the health community has learned through COVID? Because I remember, start of the pandemic, is it mask, no mask? Do we know? Gloves, yes, no. There's the arrows going both ways in the grocery store. Like what have you learned is
Well, I mean, I think the thing that we've learned probably more than anything else is how it's spread, and really it's coughing, sneezing, droplets in the air that are taken in through our body. I know early on during the pandemic, we would be worried about making sure all the surfaces are clean, and we would spray everything down. And what we found is that COVID really isn't spread through that mechanism. Which is probably a blessing for many things in terms of the cost and the staffing that it would take to keep everything clean and sanitized. But I think it's also important to remember that there are other things that do spread that way. And as we get into cold and flu season, wiping things down is probably a good thing.
Thank you. A couple more minutes today with Dr. Eric Davidson. Is there anything that has surprised you during this, what is it, almost 2 years? It seems like a year and a half.
I keep saying it is how well the staff and faculty at Eastern work together. It would be real easy to pigeonhole and say this should be the responsibility of the medical clinic or health and counseling services, or this should be the responsibility of this entity. And it's really a collaborative effort. And I think as a team, we've really come together and we have worked well together, and we have learned how to work better together. And I think that there have been a lot of offices that may have been isolated and siloed, that this has really given an opportunity to really enhance communications and collaborations with. So I'm really happy and proud to be part of that team approach.
Any last questions?
That's all I got.
I guess if someone wants to get a hold of you or your office, or or maybe a student on campus that needs some advice or help, best way to do that, Eric?
Best thing to do would be call Health and Counseling Services at 581-3013, or to email me at esdavidson@eiu.edu.
Well, we appreciate you coming in so much today.
You.
And again, we'll probably see you again anyway, but we just hope next time it keeps getting better, right?
Yep, exactly.
And I think things are on the upswing.
I'm pretty positive about the direction that we're headed.
And is all the COVID information on your website if people are?
The best source would be the university's COVID website.
All right.
And that would be eiu.edu/COVID.
All right. Well, everybody have a safe and a great day. We are WEIU.